meeting to discuss the South African outbreak of the COVID-19 variant of the virus. My name is Councillor Simon Morrell. As the ward councillor for Frankley Great Park, it falls on my responsibility to chair this official operation briefing tonight, which is open to all members of the public and host to councillors from across the region. In attendance tonight, we have got Gary Sambrook, the Birmingham Northfield MP. We've got Councillor Adrian Delaney from the Ruby and Rednall ward, Councillor Debbie Clancy, who is Longridge and Westheath, and Councillor Eddie Freeman, who represents Adams Cross ward. There will be a separate meeting later tonight with Councillor Ollie Armstrong. So if anybody can't make this particular meeting, whether that's for childcare commitments or because they're running late from work, then do tell them that they are welcome to join that meeting. I'm really humbled and pleased today to be able to host Councillor Paulette Hamilton and Dr. Justin Varney. Councillor Paulette Hamilton is the Labour Cabinet Member at the City Council for Health and Social Care, and Dr. Justin Varney is the Director of Public Health at Birmingham City Council. And for those who know my campaigning, I do a lot of campaigning for mental health. And that's we did a suicide prevention strategy at the City Council. I was only half of that story. It was also Councillor Hamilton and Justin Varney who did a lot of work in that. So I'm I hold these two people in very high esteem, and I hope people today will listen to what Dr. Varney has got to say to you, because he does know what he is talking about. And very briefly, just on the topic of mental health, I do feel that people during these times, obviously this is quite extraordinary, but I don't want people to panic, and I would put a call to people to reach out to people in the community, get on the phone to them, have some conversations, and together let's do our patriotic duty to make sure we can kick this virus out of Frankley. Few house rules for this meeting. This is a cross-party effort. This is not a political forum. We have obviously the Labour-run Birmingham Council and a Conservative-run government. We also have a parish council in Frankley who I know are keen to get involved in this, and they are non-political. So we are all prepared to leave our politics at the door. I would kindly ask residents to do the same. We will be opening the floor to questions later on, and I would like it if people could keep those questions to the topic at hand, keep them pragmatic and constructive, and obviously we will not tolerate any abuse at this meeting. So while I can see people are still entering the meeting, what I would like to do before I bring Justin Varney in is to hand over to Councillor Paulette Hamilton, who is the Cabinet Member for Health and Social Care, just to explain very briefly about the work the Council has been doing around COVID-19 in the city. And then after that, I will hand over to Councillor Varney to explain more details about what they're calling Operation Eagle, which will be rolled out in Frankley Great Park and parts of Northfield in the coming days. Thank you. Over to you, Councillor Hamilton.
Thank you, Councillor Morrell. And can I just say hello to Gary Sambrook, who the MP for the area, who has fully kept me briefed of what you guys have been doing out there on the patch, and I want to publicly thank him for everything he's been telling me, so that I know that the residents are being fully briefed by all the councillors and the MP in the area, and I thank you for working as a team. Over the last year, as you know, COVID-19 has been this pandemic has been a real issue in Birmingham and across the UK. But in Birmingham, through public health and social care, both children's and adults, and across the council, with the leadership and all the other members, we have managed to do a really good job to ensure that we have got the information out to the public. We have used things like the COVID champions, and we have used local residents, our faith groups, and also we have worked with many of our young people. We have been going onto social media. We have also done a great deal of work with our local radios and through the television at times to ensure that we inform the public of what is going on. Operation Eagle is something that we really only found out about it in Birmingham less than a week ago. And Dr. Varney and the team and the politicians across the council, we've worked really hard to ensure we get the information out to members at in a timely manner. I know that people are concerned about this particular strain of the virus, but I'm not going to say advice. What I would like to say to everybody at the meeting tonight, we'll be all right. Just like with Captain Tom, what he did over the last year to bring this country together, Frankley and Northfield will be all right, as will the other places in Birmingham. What we're asking of you tonight is go out, ensure you get tested so we can know if there is any spreads out there. But also I'm begging you, if you get your letters to get the vaccine, please do not hesitate to do so, because this is our way out of this pandemic, is for everybody to take that vaccine and to ensure that you take the second jab, but in between, ensure you continue to keep your distance, wear your masks, socially isolate, and wash your hands regularly. And if you have any symptoms of a cough or a high temperature, aching joints, please remember to go and take your test. So I'm going to leave it there, because Justin is who you've come to listen to about the actual virus itself. So Councillor Morell, I'm going to hand back to you, and thank you.
No problem. It's a pleasure, Councillor Hamilton. And I think I speak on behalf of the whole community when I say we pass our condolences on to the family of Captain Tom Moore. He really was what I would define quintessentially British. So with that said, I'm now going to hand over to the man of the hour, Dr. Justin Varney. Thank you so much for coming to the meeting today, and I really appreciate the work that you're doing. So over to you.
Thank you, Councillor, and thank you everyone for coming together today so quickly to meet on this important topic. I'm going to talk first a bit about what a new variant of concern is, and then about what's happening in the local area. So first of all, variants of concern are variations in the virus. Viruses change all the time. It's completely normal and part of what viruses do. Most of those changes mean the virus gets weaker and less effective. But sometimes we have a virus that changes and it becomes stronger. And the three things that make us worried are if the virus changes to become more infectious, if the virus changes to make more people go into hospital and die, or if the virus changes and it means that the vaccine is not as effective. So if any of those three things happen, then it is called a variant of concern. Now, around the world, there are 4 countries with variants of concern. In the United Kingdom, there was the variant that appeared in Kent and London. There are variants from South Africa and from Japan and from Brazil. And I'm pausing to allow Wayne to keep up with the sign language because it is hard work for him. So Wayne, if you need a break, just let me know and I will pause. So where we identify a variant of concern, we go and we try to identify how it came to the UK. So in this situation, we have cases of people who have the virus of a type which is only found in South Africa. And when Public Health England have talked to them to try and identify where they caught the virus, they cannot find any connection to a plane. There is no direct link to South Africa. Now, the virus, when we test for it, we test using the PCR test, which is the swab to the back of your nose and the back of your throat that is then sent to the lab. The first stage of the test tests if you have coronavirus, and then routinely we take 5% of samples nationally, and we do another test which takes 7 weeks to identify the genetic code of the virus. And that's how we find out that it's different. Across the world, there is a directory of these genetic codes, and we are able to match them. And that is how we know that this variant comes from South Africa and is not normal in the United Kingdom. Can I just remind everyone to please turn off their camera if they are not talking, so that those who are using the sign language interpretation can see Wayne, because otherwise it shrinks his camera to very small. Thank you. So we became aware that we had cases of the new variant from South Africa in Birmingham at the end of last week. On Monday, Public Health England told us that having done the investigation, they could not link these cases to a plane and overseas travel, and therefore we would be considered to be joining Operation Eagle. Operation Eagle is a national approach to controlling the spread of the new variants. In Operation Eagle, we are testing about 10,000 people to try and find if there are other cases of the variant of concern, to be able to fill in the jigsaw to find how the people caught it and to work out what the link to South Africa is. So this is the same approach that is being used in Warsaw, in Surrey, in Liverpool and Bristol, and several other areas around the country. So we are now starting a programme of asking everyone who lives in Frankley Great Park or in the area identified at the south end of Northfield, around the Tessel Lane area and the A38, to take a PCR test through one of the identified testing sites. It is important that people test through the designated sites, because all of the testing kits will be going to a specific national laboratory to be processed, first to identify if there is COVID, and second, then to test if it is the South African variant. We are only testing people who live or work in this area. And that is because there has not been any travel by the cases or their contacts outside of this immediate area. We have drawn a circle around the cases, and this is a very big circle. So if you live on the far side of the border and you are outside of the zone, you do not need to worry. There is a big distance between you and where the cases are. We have taken that into account. If you have symptoms, you should get a test through ringing 119 or booking on the NHS website, and they will direct you to different testing sites, because we do not want to mix people who have symptoms and people who have no symptoms. There is no need to isolate while you are waiting for your test result if you have no symptoms. And there's no need for you to avoid work. You can continue to work or go to school. You can continue to get your vaccination if you are due one, and you can continue to go for healthcare appointments while you wait for your test result. If your test result is positive, then you need to isolate. So there are several places where you can get tests in the area, and we are opening more of these each day. As I said, we only found out on Tuesday night that we were definitely included in this approach. So we are moving very quickly to try and respond. You can walk or drive to the testing site at the Longbridge Business Park, the St Modwyn site. That site is open from 8 AM to 4 PM, and you can register at that site. If you are going to that site, please take a telephone with you, a pen, and some hand sanitizer, because you will need to fill in a bit of paper, and you will need to clean your hands for anything that you have to touch. From tomorrow, there will be another site at the Empire Car Park, so by the cinema, and that will also be open. The opening hours will go up on the council website. Unfortunately, they did not tell me tonight before I came on the call to confirm, but I think it will be 10 till 4 tomorrow and on Sunday, and then hopefully longer on Monday. We have also opened a collection site at Hollymore Community Centre, where you can walk to or drive to pick up testing kits to take home, and you must return them to the centre within 24 hours. The centre is open from 8 in the morning to 6 PM to collect kits, but you must drop kits back before 5 PM because we have to return them to the laboratory that evening. Next week, we hope to open more hub sites, and we will also be starting door-to-door testing in areas where people have not tested, and to ensure that people who cannot leave their home are able to access tests. If you have tested positive in the last month, then you do not need to do a test because the laboratory can still find them. When you do the test, you will get a result in about 1 to 2 days. That will tell you if you are positive or not. It then takes another 10 days to test if it is the South African type of the virus, because that is a more complicated test. If it is positive for the South African variant, then someone from Public Health England will ring you and talk about what extra things they need to know about where you have been and to work out how you might have caught it. They will not ring you after 10 days if it is not South African variant. But if you have tested positive, NHS Test and Trace will contact you usually the day after your positive result. I'm thinking if there is anything else I need to cover before I move to questions. The testing that we are doing is trying to identify where this South African variant may have come from. there are two potential things that will happen. Either we will find more South African variant, and it has already spread in the wider community in all the areas where we are doing the extra testing, or we will find one or two cases that explain how it came to be here, and then everything will continue. We will not know that for probably 3 weeks. It is important to say that the South African variant transmits in the same way as any other type of COVID. It is the droplets that come from our mouth that spread the virus. The South African variant does not make them go any faster or any further. So the 2 meters distance is the same. The hand washing is the same. The face covering is the same. And all of the risk management in schools and nurseries and workplaces is the same and will prevent the spread of the virus. You do not need to wait for your result to continue, because this is a search for cases in people that do not have symptoms. So please continue to follow the advice of hands, face and space. If you have had a vaccination in the last month, you should still test. The vaccination after the first dose gives you some protection, but not all protection. And after the second dose, it still may not be perfect. So we want you to test as well. We are not testing under 18s at the moment because they are tested in school, and also because this is more infectious. If it is in a house, in a family, it would be very unlikely for just the children to have it. So the decision is, at the moment, we should not put children through the extra test unless we have to. We have put a lot more information on the website every day as we have got more information for government. This is a new situation that only really appeared over the last week, because it takes many weeks to identify the new variant. It has been a while before we got this information, and that may feel like everything is moving very fast at the moment, but that is because we are updating it as we find out more. As Councillor Hamilton and others have said, it is important that we stay calm. We are aiming to have as many people tested as possible over the next 10 to 14 days. So you do not have to get a test tomorrow. Today, we already gave 770 testing kits from the Hollymore Centre, and that only opened at 12 o'clock. Yesterday, we did over 650 tests at the St Modwyn's site, and there was more capacity today. So please do get a test, but please also be patient. And if you are unable to get to any of the testing sites, we will be starting doorstep testing next week. We have also offered businesses and schools and health settings in the area the opportunity to have testing kits delivered to the workplace for staff to test at work, and then we collect them from the workplace. And those deliveries happen between Monday and Thursday, because the kits have to be collected within 24 hours. So the business has to be open, or the school, for us to collect them, and that is why we don't do it at the weekend. So I have tried to cover the basics, and I'm happy to take any questions that people have on what is happening at the moment in the area. There is a map on the website and a postcode setting where you can check your postcode to see.
Lovely. Thanks very much for that, Dr. Varney. So I'm now going to open the floor up to questions. There are some people with their hands up and other members have written into the chat. I'm happy for people to write into the chat, but I'm also cautious to get people from the Ruby side of the border in to ask some questions, because I know that they're going to have concerns, especially being a different authority to Birmingham. We've got Nicola who wants to ask a question, who's the admin of the Ruby community group. So I'm going to ask her to ask her a question first.
Hiya, Simon.
Hello.
I just wanted to ask, with the red zone, the majority of people that are in the red zone commuting into Ruby on a daily basis for the high street and for obviously Morrison's, is there a reason why the red zone hasn't been extended to include that, because there is such interaction between the two areas?
Yes. So the zone was designed around where the cases had been, which is in their immediate vicinity. So they hadn't travelled far. And keep in mind that this variant is similar to the Kent variant. So all the things that we should be doing when we're shopping should be reducing that risk. And there is no evidence from the case histories that would suggest that any of the shopping sites were particularly at risk.
Does that include the industrial sites that are smack bang in the middle of the red zone?
So they are workplaces in the zone, so they are included, and anyone who works there is being offered a test.
Okay, thank you.
Right, sticking with Ruby just for the time being, Councillor Chris has joined us, who I believe is the Bromsgrove councillor for Ruby South, so I'll let him ask his question.
Thank you very much, and thank you very much for the full update. Is there a possibility that the way that the virus has mutated in the genetics found in residents in South Africa could naturally occur here in those people who have similar genetics?
So the variation in the South African variant is a very small part of its genetic code, and it is very specific. The mapping of the cases here maps identically to the genetic map of cases that are only found in South Africa at the moment. It is possible by chance that the same change happened here and in South Africa, but to be absolutely identical is a very, very, very small chance. So we think it is more likely that we will be able to find the connection, that someone was on a plane and that will be able to join the dots. But it is possible, but it is very unlikely to be just by chance and be a perfect match.
So that is why you are trying to find where this has come from.
Yes.
Perfect. Thank you very much indeed.
Thank you, Adrian. And just for balance, I'm not seeing, but is Councillor MacDonald in the meeting from Ruby North? I'll give him a chance to ask a question. If it's silent, then I will take that as he's not here. I will then move on back to the Birmingham side of the border. Hayley Chapman, you've got your hand up. I'll let you ask the next question.
Thanks, Simon. There is obviously a risk of this variant spreading in the local community, which is why we're being asked to test. So could you please explain why we're not being asked to isolate and can continue to go to work, and in particular the large factories in the West Midlands region? Surely are we not at risk of spreading this further? Thank you.
So the new variant is like the Kent variant, and everyone should be cautious and following the guidelines. There are no additional risk reduction needed because it does not travel any further and it doesn't infect in any different way. These cases were identified, they tested positive at the beginning of January, end of December. So now what we are doing is trying to find the missing bit of the story, rather than because we have seen the case rates explode in the area. But testing in the area has not been particularly high, and that is why this extra testing will help us get more confidence. But the factories should be doing all the things to keep staff safe, like hands, face and space. And if you are working where that is not happening, the council has an anonymous whistleblowing helpline, and let us know, because we act quickly to investigate where employers are not doing the right thing.
Thank you. Hayley, if you can put your hand on now. Next question will be William Clark, please.
Thank you, Simon. My question is, we're talking about trying to find the missing link where people have been on planes, but I don't know if it has been something that's not being thought about. But I actually live in the centre of Rubery, and next to us is the industrial estate, which imports daily large amounts of cargo from Europe, and particularly Holland and the Netherlands. And I know that the variant has been found in the Netherlands, and workers up there do actually work within the Frankley area. Has that something that's been explored?
Yes, we don't see any significant evidence of transmission on inanimate objects. So parcels and packages, post, is not a very good transmission vector.
Sorry, I was on about the drivers, because the drivers are from Holland, and they do have a driver's mate.
Yeah, so the additional testing that was introduced at the border because of Brexit, more than anything else, actually, I think reduces that risk. Also, the history of the cases does not suggest any connection, but we may find a connection through this testing, and that's why the additional testing is so important. We're trying to find the missing piece of the jigsaw.
Thank you.
Next, Sean Ryan Izzard, please. To ask you a question.
Hello. Yeah. On the advice of NHS 119, myself and my wife actually got tested at the Albury station yesterday. Now it's come back as negative, but I'm wondering if does that mean that we're likely to have to take another test in the next week or so, or will that simply be added into the system?
No, if you've tested negative, there's no point retesting, because we would be looking for positive people. The test for the South African variant is the same test, but we take the positive results and then we test them additionally. So you would not need to take a second test. If you're negative today, then there is no point.
Thank you very much for that.
Great. Next, we will take Melanie, please.
Yeah, hi. First of all, can I just say thank you so much for hosting this to reassure people and to give us the information that we need. I just wondered, how many cases have been identified? Do we know? And how will we receive updates? Would it be via the B31 Facebook page? Thank you.
So we have identified the original 2 cases of the new variant were identified, and that's what we were told about at the end of last week. We will not get the number of cases of, well, sorry, let me rephrase this. I will know in about 3 days the results of the people that tested yesterday and today, in terms of how many are positive. I will know then in about 2 weeks whether they had South African variant or not. So we won't know very quickly if there is more South African variant, but we will know quickly if we are seeing a rise in cases in the area. And we will see that because over the last couple of weeks, the number of cases have started to fall in this part of the city, but not perhaps as fast as other areas, and testing has not been as good. So we will know reasonably quickly if the case numbers stay low or if they suddenly go up. We will be sharing the information with the councillors so that they can help disseminate it in local communities. And I've talked to the councillors about having another meeting like this, probably in 10 to 12 days time, so I can come back to you and tell you what we are seeing in the results, because we need enough time for enough results to come through for me to give you a reasonable answer rather than just a guess.
Brilliant. Does that answer your question?
Yes, it does, and thank you very much. Thank you.
Brilliant. Next, I've got Woody. Woody, to ask your question, please.
Hi, just want to say thank you very much for this. Just a quick one. I actually live on the outskirts, and my son actually goes to nursery in Northfield, well, in West Heath. Because I'm coming outside and coming in, should I be stopping doing that because I've been told by the nursery that that's fine, and also that if I did stop coming in, that I will lose my funding for that? Thank you.
You are fine to continue to bring your child to nursery and to collect them, and that's absolutely fine.
Thank you. In the chat, we've had Mrs. Crawford has asked, can you confirm the accuracy of the lateral flow tests that have been given to schools? I think I already know the answer to that, but I'll let you answer, Dr. Justin Parker.
Yeah, so lateral flow tests, I'm just responding to Kay Smith at the same time. The lateral flow test is a test which is looking to see, are you infectious or not? It is a different test from the PCR test, which is testing, do you have coronavirus? But it doesn't say how infectious you are. One of the problems is that people compare them, and they are not apples and apples, but they are probably apples and oranges. The lateral flow is very, very good at identifying people who have no symptoms but are infectious, because it sees the virus when there's a lot in the swab in your nose and your throat. And then it is over 90% accurate. However, it is not a good test for people who are early in infection and not infectious yet, or late in infection when there is less virus in their nose or the throat. And the PCR is better at that test. So it is a good test for infectiousness in people that don't have symptoms, which is why it is used in schools to try and identify children who tend to have fewer symptoms or vague symptoms, but might be infectious. So it is a good test, but it is looking at a specific thing, not just infection. It is testing for infectiousness.
Very good. Is there any representatives here from the new Frankley Parish Council that might want to ask a question or contribute to the meeting?
Hi, yes, I'm here, Simon. I did attend the meeting earlier, and I asked just in there. My main concern was the elderly residents, because as you know, we've got a lot on Frankley and them accessing the tests. But Justin did kindly answer my question earlier that they will be going door to door next week. So I think that was our main concern. And as I've said to you, if you think there's anything, it seems that there's a lot of sites on the south. I didn't know if there's any plans for more on the north side for residents to get to. I'm guessing that will come next week also.
Yes, indeed, that's correct. I also, bits and bobs, I do get told bits of information, but because obviously it's all been, the machinery happens behind the scenes. I'm, as the councillor, kind of just your spokesperson. So I'm very much limited in what I can tell people before, you know, Justin and the team at the council make it official. So today there was a bit of confusion about Great Park, because I think, was it ITV News said that Great Park was going to be open, and people were asking me questions, and I couldn't tell them because I knew it was still, it wasn't confirmed. So also in terms of the vulnerable people, I'm going to be out next week as well, helping to do deliveries. So if any, and also not just the kits, but also food parcels, anything that people need if they're struggling, I will be on hand to serve people. So I'm going to now hand over. Has anybody got any more questions before I hand over to other councillors and colleagues? Don't be afraid to speak. We've got Natasha Watt. I'll let you ask your question. Natasha Watt. No, I'll move on to.
Hello, sorry, Simon. Can you hear me?
Yeah, I can hear you now. Go ahead.
This is a question for Justin. I'm not sure if this has been asked because we joined the call a bit late, but can he comment on the efficacy of the vaccine with these variants? Is there any research or evidence at all about how effective and, you know, how protected we are for those of us that have had the vaccine already?
Yes, the new variant from South Africa makes the vaccine slightly less effective, but it still works. So if we say the Pfizer vaccine, for example, after 2 doses is about 95% effective. So 95 people out of 100 have full protection, and we think 5 people in 100 have partial protection. For the South African variant, that falls to maybe 85 out of 100 with full protection and 15 with partial protection. In comparison, the seasonal flu jab gives 40% protection, so only 40 people out of 100 have full protection and 60 people have partial. So it makes it slightly less, but it is still good. And the same is true for the AstraZeneca vaccine.
Thank you. That's really useful to know.
Fantastic. Next, I've got Louis. I think that's Northfield Community Partnership. Hoping I'm right there. If you want to ask your question.
Yeah, that's right. Thank you. We've got a BSL interpreter here today who is actually doing Northfield Community Partnership a massive favour, very last minute. So thank you to Ruth for pointing out that information for the deaf community is a real issue. That includes information that's coming through from the community champion information. Sometimes there are voice notes, which just means that even if our deaf community are signed up for that information, that it doesn't necessarily mean that they can get that out to their friends and colleagues. So if these lateral flow tests are sort of going out into the community, what will happen as far as people being able to explain why it's needed? Will it, and also for people that are speak English as another language?
Yeah. So we have a partnership with BID specifically to do additional engagement with our deaf and hearing impaired residents. And we commissioned BID back in, I think, May last year. And they have been working with us throughout the pandemic to ensure that we do have accessible information. Sometimes the information is very quick and we do not have time to create an interpreted version in real time, but we are working with BID on how we can make that faster for the other information. For the drop and collect, the doorstep information, we are looking at making sure we have easy read version, because as Ruth says in the chat, we know from what BID and Adam at BID has been helping us to understand, many deaf people do not read English very well. So it is important that we think both about written language as well as sign language translation. We already have, from the government, translated instructions for the testing kit in different languages, but unfortunately we have not had the same for Easy Read or for British Sign Language. As Phoebe says, we do also use captions in meetings for information as well, but it is something we are conscious of and continue to try and improve in our partnership with BID.
Thank you, Justin. And honestly, you spoke very slowly with pauses and really understood the needs of the people from the deaf community on the call. So thank you very much for that.
Yes, I must apologise there. I have been known to be a bit of a motor mouth. So I will try my best to accommodate Wayne. Next question is Susanna Busby, please, to ask your question.
Hello, I'm asking about you going to the door-to-door testing, which is obviously going to be mainly the old people who don't go out. But people who are actually going to the testing sites are being told to register online. Now, my parents live in an area that they would have door-to-door testing, but they're certainly not going to be able to register online. How would they be notified of results?
So there are two issues here. One is the registration process, which is designed and decided by government. We have repeatedly highlighted that it is not accessible for people who don't use a computer routinely, and that there are things that are required, like the barcode number, that are quite small and difficult to read. But it is set by the national system, not by us locally. We are trying to work out if there is anything else we could do through the people on the doorstep, perhaps being able to help people register. But because registration requires personal details, that is difficult. But we are trying to think of a way to make it easier, maybe with a paper form that the person could fill in and then give to the person on the doorstep to upload for them onto the computer. The second is that these kits are that are sometimes difficult to use, because you have to use the kit and then put it in a box which you fold and make. And we are also looking at how can we help people understand, and maybe do some extra videos at the beginning of next week to show people how to use the kit and also to show how to do the registration. But these are not lateral flow kits. These are PCR kits. So these are tests where you use the swab, which looks like this, to the back of your nose and the back of your throat, and you put the swab into a test tube, break it, seal it, and put it in the box and seal the box. That is very different from the lateral flow kit. But I am very aware that for the elderly and for people who have learning difficulties, we need to think about how we can make this more accessible. Sadly, it is not a new problem, but it is one it is difficult to solve at a local level.
Thank you. Next question is from Steve, please. Steve, to ask your question.
Thank you, Simon. Good evening, Justin. Just a quick question. Obviously, with resources being tight, with the testing, will that affect the rollout of the vaccine in any way?
No. The council is leading on the testing and the NHS is leading on the vaccination. And we are very careful that the vaccination is continuing to work while we do this separately.
Okay, thank you.
Brilliant. And I see one more hand up from a member of the public, Trish Thomas, to ask your question, and then I'm going to open up to local councillors.
Hiya, yes, thank you. I'd like to ask a question regarding the home testing for the elderly and vulnerable. I'd really like to be assured that you've got contingency plans in place to make sure the safeguarding, to make sure that legitimate people are actually visiting the homes of these people. They will be very frightened at just having a stranger knock the door.
Yes, absolutely. And that is why we are working with a company that has staff that are trained in safeguarding and are used to doing door-to-door work. They will also have ID, and they will also have the high-vis tabard with the logo of the council. And we are doing additional training for them to ensure they understand what we expect as a council in terms of behaviour and conduct.
In response to that, anybody can get hold of a tabard, anybody can have a piece of ID that looks legit. Wouldn't it be better to perhaps make an appointment with the individual beforehand so that they know to expect a legitimate caller?
Unfortunately, in the time frame that we have to do this testing, we do not have the capacity to run a booking system for this. It is just not practical to be able to do that. We are looking about whether there are additional things we might do, particularly for housebound and vulnerable individuals who we know will struggle with this system but are well known to adult social care. However, their risk is probably the lowest, as they are very unlikely to have been out and mixing with other people over the last couple of weeks.
Okay, thank you.
Brilliant. We've got 15 minutes left, and I'm conscious that I haven't brought the other councillors in yet. So I'm going to try and quickly get them to have a few comments and allow members of the public to put their hands up. I've noticed one has just gone up now. I'm going to try and get back round to you, but I just want to make sure that everybody spoke. So Councillor Adrian Delaney, who represents Ruby and Rednall Ward, if you want to say a few words and let people know how they can contact you.
Hello, Simon. Thanks very much. Just to thank you, firstly, for chairing this meeting tonight, and for Paulette Hamilton and Justin Varney for attending and answering the questions. If anyone in Ruby and Rednall Ward, which is the Rednall Triangle and Cockhill, has any concerns or questions, they can email me at adrian.delaney@birmingham.gov.uk or phone me at 0121 303 2130. Those details are also available on the Birmingham City Council website. I've got a couple of I had a number of residents contact me with questions. Many of them have been answered tonight. I've got a couple of points. The two individuals that have been tested positive for the South African variant, what are we doing to ensure that they are actually self-isolating and not leaving their home? And secondly, we have COVID marshals in the city. Is there any chance that we could encourage them to visit the area to ensure that people are actually abiding by the rule? Thank you. That's for Justin Varley, that is.
So the individuals who tested positive with the South African variant did so about 7 weeks ago, and they are no longer infectious. And they also did everything that we wanted them to do in terms of isolation at the time. And they were, in fact, a very good example of what good looks like in terms of isolation. Sorry, you'll have to remind me of the second question, Councillor. My
The
mind went
COVID
blank.
marshal.
The COVID marshals. Thank you. Yeah. So we have already redeployed some of the COVID marshals into the area to strengthen the visible presence and to ensure that behaviour is appropriate in terms of particularly the shopping areas, which is where we see most risk. And that will continue for the next couple of weeks. So we are redeploying more people into the area to support that. We also did a meeting today with the schools in the area, so they were briefed this morning, and with the community and voluntary sector organisations. And we will be doing another session with businesses in the area early next week.
Brilliant, thanks for that, Adrian. Next, I'll move on to Councillor Debbie Clancy from Longridge and West Heath Ward. If you want to say a few words, Debbie, please.
Thank you, Simon, and thank you for hosting the meeting tonight. Justin and Paulette, thank you also. It's been invaluable, the information, and certainly I've picked up information that I wasn't fully understanding myself, so I can understand the community's fears. Justin, you very rightly, in my opinion, said that you would suggest another meeting of this type in, say, 10 to 12 days' time. And I would welcome that, because I think with this situation at present, people who have joined tonight would like to rejoin again and see where we are with the journey of information. So I would definitely go along with that. And I would presume with the science and the results you get back, we would have an update on the uptake of numbers of people that have come forward for the testing, however that is, whether it's door to door or the designated sites. And I think that's really important. One very brief comment. There's been a lot of information tonight, and my apologies if I've missed it, but with the frequently asked questions we've had, and they've been excellent, is there this type of information on the website available for FAQs? This is probably on many people's minds that haven't accessed the meeting tonight, and somewhere where they can visit and see those similar questions and answers. And that's my comment. Thank you.
Thank you. Yes, on the website we have an FAQ section. I will put the link into the chat box, and we are continuing to update it as people ask questions. Every day we have added a new one as people have asked very sensible questions, so that everyone can access the answers.
Okay, Councillor Eddie Freeman, Allens Cross Ward. If Councillor Eddie Freeman is in the meeting, would you like to say a few words?
Yes, thank you, Chair, and thank you for all this, yourself and all the speakers. And yeah, if anybody's got any problems, do contact me on the usual channels. And I want to thank everybody for who's volunteered to do the work on Longbridge and Great Park. Thank you very much, Chair.
Brilliant, thanks, Eddie. And I'm also going to bring in Gary Sambrook, our Member of Parliament, if you've got a few words for members of the public. Thank you.
Thank you, Simon, for that, and well chaired this evening. Thank you. It's very useful to have this meeting for everybody because it's been an anxious couple of days for everybody. I just wanted to say, firstly, that if you have any questions, I know that all our councillors and my team in the office are working 7 days a week at the moment until very late at night. So if you have any questions, we're only at the end of a phone or an email. So if you'd like to email me, please do gary.sambrook.mp@parliament.uk, or you can call the office on 0121 472 0740 if you have any questions. And if we don't know the answer, I've got Justin's mobile number, so he'll definitely know the answer, so we can get them to you as quickly as possible. I just want to say that a lady earlier asked a question about the vulnerable people, elderly folk, and door knocking, which is a very good question. And I think between me and Justin, we can follow up with the police, who may be able to help with doing some extra PCSO patrols around the area, just to double check sometimes that the people knocking doors are the legitimate ones who are doing the dropping off of tests, because I think that's a very good point. But there are some very vulnerable people who will be worried about answering the door. And just to say thank you to Justin and to Paula and their team in the council, because over the last couple of days they've had an heroic effort to make sure that everything is up and running as it is at the moment. And all we can say is that you pass the word on to your friends, your family and your neighbours to go and get a test over the next couple of days and weeks to make sure that we can break the chain of transmission and we can get a better picture of what's going on. So thank you very much, everybody.
Thank you, Gary. And I'm going to open it back to members of the public now. From the current Member of Parliament to the former MP, we have Richard Bird joining us this evening. Welcome, Richard. I will let you now ask your question.
Thanks very much indeed, Simon, and thanks to everybody for organising the meeting, and again thanks to Justin for all his work over the past months, and also thanks to Paulette for being here. I've just got 2 points to make. The first is in relation to the question of people who either haven't got internet access or are not confident about using it and registering test results. This is an issue, as others have said tonight, which I don't think has got an easy resolution or an immediate resolution. However, I was dealing with a case of people who had this problem today, and they did find that they were able to get help by phoning 119 and were able to get through on that number, and the person on the other end of the line actually basically took the information from them over the phone and entered it online. So it's not a perfect solution, but there is that help available if people can get through on 119. The other thing I was just going to say is, for my sins these days, I'm chair of Health Watch in Birmingham and Solihull, which is the independent consumer and patients champion. And it's really a plea, if anybody has got any feedback on anything in relation to the pandemic, about the work that's being done, about the vaccination programme, about their experience of testing or whatever, we really do want to hear from you. You can contact Health Watch Birmingham by telephoning on a free phone number. I'll say it slowly and then I'll put it in the chat. 0800 652 5278, or you can email info@healthwatchbirmingham.co.uk. That's info@healthwatchbirmingham, that's one word, .co.uk. Thanks very much.
You're on mute, Simon.
Oh, my apologies. So I'm going to ask a question myself now, and I'm going to bring my day job in as a web developer. But I'm concerned about fraud. There's been a lot of malicious emails going around, getting residents to pay, basically pretending to be from the National Health Service when they are not. Do we know what the council's doing to counter that? Because I think during a crisis at the moment, there'll be a lot of dodgy people out there that would want to take advantage of this situation. I think we need to do everything we can to prevent that. Thank you.
So that's exactly why we're asking people to go to the council website for trusted information and not to rely on alternative sources, because there is a risk that they could be sucked into fraudulent behaviour. We're working closely with the NHS on vaccine fraud, as they are the lead for vaccination. And where emails are alerted to us, they are alerted to the NHS and also to trading standards. So we are working together to address this, because it is sad that some people are trying to take advantage of the situation to get money out of our most vulnerable citizens.
Thank you, Justine. I've just noticed another councillor has joined us, Councillor Judy Johnson, who's councillor for Wheeley and Sally Oak Ward. Welcome, Councillor Johnson, if you want to ask your question.
Hello, thank you. Just a very quick question, and that was, what are we doing to assist our residents that are bedridden, both with being able to get tested and also for the vaccination programme?
There is a programme on the vaccination for housebound people, which has now been rolling out for over a week through the NHS, and they will be contacted by phone to book an appointment for the home service to come, which is run by the Community Trust in Birmingham and Solihull. For testing, it is unusual that someone who is housebound has been exposed to the virus unless it is through someone coming into their home. And there is now better testing and regular testing for carers, and we are encouraging informal carers and people in social care bubbles to test regularly through the lateral flow testing route to help protect those that are housebound.
Thank you. It was the carers that were coming in that was my concern, or it's people that have contacted me, or it's via people coming in that are their regular carers, obviously not the person who's housebound, as you say. Thank you, that answers my question. Thank you.
Right, Nicola from the Ruby Community Group, you've got a follow-up question?
I have, thank you. I just wanted to check, in response to, I think it was Councillor Delaney's question, you said that your biggest concern and therefore redeploying COVID marshals was shopping centres and shopping facilities. Can we just request again as a community that we're looked at to be considered for the red zone, because we are the biggest shopping community for all of those people in that red zone? Pretty please. And can I also say, if any of the councillors want all of their contact information put onto the community page, it obviously covers all of the red zone and slightly extended. So obviously just drop them to Simon and he'll send them across to me. Thank you all.
So the decision about the area is made with Public Health England based on the evidence and the history of the cases. At the moment, it's not appropriate to expand the affected zone, but we will continue to look at this as we start to see the pattern of positive results. And if we see a pattern that links strongly to retail, then we will revisit the scale of the zone.
Thank you.
Thank you. Unfortunately, we've got 3 minutes left. So Steve, if you want to ask your question very briefly, and then I'm going to make some closing remarks.
Thank you, Simon. Justin, there's, following on from Simon's point about fraud, there's a lot of misinformation online, especially local news sites and everything else about vaccinations and testing being false or inaccurate or dangerous. Is there anything in measure that the Birmingham City Council are doing to stop this misinformation being spread around as such?
Yes, there is a lot we're doing with the NHS. Through our COVID champions, we have been doing vaccine understanding sessions. We are also now offering these to care home staff as well. And we have been providing them to our faith leaders as well in the community. And Councillor Hamilton has set up a series of city conversations about vaccination over next week. The first one was last night in the north of the city, and there is one for the south, the east, the west, and the centre.
Thank you.
Thanks for that. Right, I'm just going to now make some closing remarks to members who are still here. And that's just to say, as your elected councillor, when I was elected, I did promise I wanted to try and put Frankley back on the map. This is certainly not how I envisioned it. But I have to say, I am thoroughly impressed in the space of 24 hours with the response that we have had in this community. For the test kits at Longridge to run out in the first day is great. And I want to just say to people to keep your spirits up, contact local people and make sure that everybody are okay. And do your patriotic duty to get a test, because I do think that we can set a real example here, not just in Birmingham, but for the wider region. If we step up to the plate when this sort of crisis happens, we could be seen as a model for other areas of the country to follow moving forward. So there's a lot that we can come out of this, and I'm very confident as well. We will come out the other side of this crisis. We're going to have a great summer of love once everyone's vaccinated, and we're going to go. And the England football team are going to bring back the Euro Cup. I'm certain of it. So there's lots to look forward to. I want to thank everybody for joining the meeting today and for your patience. You can contact me as always. My email is simon.morale@birmingham.gov.uk. I'm also very accessible on Facebook. You can send me a direct message or comment on my wall, and I will get back to you. In the meantime, I want to thank everybody who's came today, all the guest speakers, in particular Councillor Paulette Hamilton, and to Justin Varney. Once again, I'm in your debt, mate. I really appreciate the work that you're doing. And if there's anything that you need me to do, just get in touch and I'll jump on it straight away. Okay then. Thank you very much, everybody. Have a great
Justin, thanks, Pam. Thank you, Simon. Have a nice evening. Be safe.
Thanks, Simon. Well done.
Yeah.
Thank you.
See you, Deb. See you, Gary.
Everybody.
See you,
Thank you.
Adrian. All right.
Thanks, Wayne.
Good night, all. For the
Thank you.
invite.
Sorry.
Richard.
Thank you for that.
Everybody stay safe.
Wayne.
Goodbye.